Welcome to the VHIA tutorial that we have put together to assist community health centres in navigating the VHIA briefing document sent on the 2nd of January regarding the bargaining for the social workers, community development workers, welfare workers and youth workers, collectively known as SACS employees, and the accompanying spreadsheets that enable community health centres to cost the ASU counterclaim and the VHIA proposal 2. We will have a particular focus on explaining the VHIA proposal 2 in this tutorial. So what you have showing on screen at the moment is the briefing note that we sent to members on the 2nd of January. We have a table of contents that outlines the structure of the briefing document. Part 1 includes the ASU counter-proposal and the VHIA proposal 2. Part 2 includes the ASU other priority claims. On page 2, we have developed a brief comparison table of the VHIA proposal 1 that is supported by 17 community health centres and the ASU's new wage proposal. The important item to note is that the ASU is no longer seeking parity with public sector health professionals, but is seeking an outcome for wages above the minimum wages. Now, when we refer to the minimum wages, this includes the wage increases that were awarded under the Equal Remuneration Order, aka the ERO. What we have tried to do throughout the document in comparing the proposals is to break down the elements, and there are 4 elements. What we have is a July increase each year is the first element. The second element is additional increments. The third element is bringing forward the ERO by 6 months. And then we have top-up payments. We won't go into detail here, as we will be going through the detail when we outline the VHIA proposal 2. On the next few pages, what we have on pages 3 to 5 is the VHIA commentary on each element of the ASU proposal. Again, we won't take you through the commentary now because we will be taking you through the commentary when we go through the VHIA proposal 2, but our commentary is written on page 3 all the way to page 5. On page 6, this is where we are asking community health centres if the ASU counter-proposal is an affordable proposition. To do the costings, members will need to review the wage rates. The briefing note that we have on screen now did contain links to the relevant wages, but they have now been outdated and replaced by the spreadsheets that we sent in an email to community health centres on the 9th of January. We will address the spreadsheets towards the end of the video tutorial. What we also have on this page is a table that outlines the structure of the spreadsheets and the purpose of each tab within the spreadsheets to give community health centres some background information on what is included. Again, we'll go through the important tabs to review on the spreadsheets towards the end of the tutorial. On page 7 to 9, this is where we outline the VHIA proposal 2. This is amended from the original counter proposal that 17 community health centres were in support of, and it is an increased proposal. So, taking you through the elements, we have a July increase each year. The VHIA proposal is to set a specific July increase rather than leaving it as an unknown factor. The previous VHIA proposal was that the July increase would be whatever amount the Fair Work Commission awarded. The benefit to setting an amount of a percentage increase in July is that community health centres will know exactly what wage rates they are committing to under the bargaining process. The ASU is claiming that there is a specified July increase of 2.5% commencing from the 1st of July 2016. For the VHIA Proposal 2, the ASU claim for this element has been incorporated. However, we know that this may not be achievable for all community health centres, so we are asking for feedback on this element. So this is where we've got the feedback that we're being highlighted. So first of all, what we're doing is we're asking to community health centres, do you agree to set a July percentage increase? Are you happy to fix a certain amount and offer a certain amount in July? And if yes, what percentage amount can you afford? This, say for example, might not be 2.5%, but maybe 2%. What we're also asking for is when can this apply? Currently, it's set as the 1st of July 2016, but it may be that your community health centre can't afford a financial hit for July 2016, and then therefore your increases would apply as of a later date. And what we've got in our fourth question is we're asking community health centres that if they don't agree to set a July increase, do you have any other suggestions on what might resolve the bargaining? Then we have the second element of the proposals. The ASU has accepted the VHIA Proposal 1 of the additional increments of $17.50 to apply only to those employees who translate to the modern award classification SACS levels 1 to 5. However, they want it to apply earlier in 2016. The original VHA Proposal 1 applied the increments as of 1st of July 2017. In addition to this, also what they would like to do is apply the $17.50 to the relevant pre-modern award classifications. On page 4 of the briefing document, we have outlined an example of what effect this has on the wage rates, but it will differ depending on the translation for your employees. So please, if you would like more information on the effect of this element, please refer to page 4 of the briefing document. The VHA Proposal 2 accepts this element of the ASU counterclaim, but again, we know that this may not be achievable for community health centres based on budgetary forecasting, and again, we're asking for further feedback. So our first question here is that does your community health centre also agree to applying $17.50 to the pre-modern award levels? The second question we're asking is about the date. So can it apply as of the 1st of July 2016? And if it can't, what date could it be applied? Thirdly, we're asking for community health centres that don't agree to the $17.50. Are there any other ideas that you might have for this element that might resolve the bargaining? The third elements of the proposals is the equal remuneration order brought forward 6 months. Now, the previous VHA Proposal 1 did bring forward the equal remuneration order, but the VHA Proposal 2 does not. And what we're doing is instead of bringing forward the ERO 6 months earlier, that is instead of paying the ERO in December each year, you bring it forward and pay in July each year. We are saying the VHA proposal no longer does that, and instead employees will get top-up payments. With the VHA proposal, the top-up payments that are proposed are a percentage of $17.50. For social workers, it is 70% of $17.50, which equates to $12.25. Community development workers, 60%, which equates to $10.50. And for welfare workers and youth workers, 50% of the $17.50, which equates to $8.75. The top-up payments are slightly indexed over time, but the VHIA proposal provides a methodology that can be easily explained to the ASU and its employees. We have asked the ASU if there was any basis of the percentage top-up payments that they've used, and they have told us no. So with the VHIA proposal, there is definitely a methodology that can be explained of where these amounts came from, which are these amounts here that I'm circling. It's important to note that unlike the ASU proposal, VHIA is not proposing that these amounts apply to the people that get the additional increments at element 2. There is not a double up on over award payments. Again, because community health centres may not be able to afford the VHIA top-up payments, we are asking for some feedback on the element. First of all, we're asking, can your community health centre agree to the top-up payment in accordance with the VHIA example? Then what we're also asking is that if your community health centre can't, can your community health centre agree to different percentages of the $17.50? But also we're asking for when can it apply from. So the current VHIA proposal is that it will apply as of 1st of July 2016. And again, this means that community health centres will take a financial hit for the current financial year, which might not be affordable for community health centres. So now, can it apply as of, say, for example, the 1st of July 2017? Lastly, we are asking community health centres that cannot agree to any top-up payment, are there any suggestions for the element that might resolve the bargaining? On the rest of the pages 8 to 9, we have some links to the wage rates. Again, these have been outdated and have been replaced by the wages that we sent on the 9th of January. And we also, again, have explained the structure of each spreadsheet, and it is the same for each occupation, but the figures do differ. So that members can give feedback on the VHIA proposal 2 and calculate other amounts, the VHIA 2 proposal spreadsheets allow for community health centres to change the figures. We will now take you through the important tabs in both the ASU counter proposal and the VHIA proposal 2. This is on the email that we sent on the 9th of January. We will take you through the social worker spreadsheets because the format is the same for the other occupations, but they again do differ and contain different rates because of the differing classification structure. Now what we have on screen now is the email that we sent to community health centres with the amended wage rates due to some errors that were found. What we have is we have 2 lots of tables with the relevant wages. For the ASU counterclaim, we have a link to the social workers here, community development workers, welfare workers, youth workers. What it also does is it just explains where there are differences from the previous spreadsheets that were provided on Monday, the 2nd of January. This email does contain 2 lots of spreadsheets, so it is important that members refer to the correct spreadsheets. The first table contains the ASU counterclaim revised spreadsheets, and then we have the second table, which contains the VHIA proposal 2 spreadsheets. This is the same format as above. So to click on the relevant spreadsheets, you just have to click on the link, depending on what occupation that you would like to look at. So for the examples that we're going to do now, firstly, we're going to look at the ASU counterclaim spreadsheets for the social workers as an example.